Good evening, parents. We are delighted to have you join us in the important and informative live workshop, curated to help parents make more informed decisions as their little ones return to their school life. With your little ones stepping back into physical classrooms, playgrounds, and peer interactions, it has become extremely important to ensure that their immunity is strong enough to fight any serious infection that they might be exposed to. So, while the first few years of immunization are well tracked by most parents, many are still unaware of the fifth year booster dose for DTP, that is, diphtheria, tetanus, pertussis, and polio. However, it is important to understand that a child's exposure to infectious diseases increases during the growing school years, and hence, this is very much important when their immunity needs a boost. Vaccines are one of the most effective tools to safeguard public health. And this stage, they help to reinforce your child's shield to keep your child protected against diseases that may have become rare but can still pose a serious threat. By immunizing your child, you're not just protecting them, but also ensuring a healthier future for everyone. And this session goes beyond the regular checklists. It is dedicated to empowering you as a parent in the post pandemic world where infectious diseases are once again in the spotlight. So, we aim to provide you with a clear and practical insights that will give you in making the best choices for your child's long term health. For this workshop, we are privileged to have Dr. Sandeep Gupta, who is the consultant pediatrician and child specialist, Bangalore. Dr. Sandeep Gupta brings more than a decade of expertise and experience to the table. Dr. Gupta holds immense specialization in child growth and development, pediatric diseases, childhood illness and infections, child nutrition, newborn care, and vaccination. Dr. Sandeep, thank you so much for joining us. Please share your thoughts on today's topic.
Yes, thank you for inviting me for this talk, Neha, and the team. So this has been a very important aspect where parents have a lot of problems when the children start going to school. They see that children often fall sick with many infections, especially fever, cough, cold is very common these days. Whenever the child goes to school, this becomes a very common occurrence. And although the most illness are minor illnesses, but sometimes children may get serious infections if we are not vaccinated well. So today we are going to discuss as to what all the aspects where vaccination is important for children and when they actually enter the school at 5 or 6 years. And it is very important to cover them with the essential vaccines like DTP, flu, MMR, and chickenpox vaccine once they actually going to school. So let us have a discussion on this, and hopefully many of the parents will have their own questions which they want to ask. We can answer them and solve their queries.
So, thank you so much, Doctor. The information really helps the mothers watching this Facebook Live. So, there are many more questions that I would be asking you during this live questions. But before we continue on this, I would want to let all the parents who are watching us right now that we are taking questions on this live. So, if you have any queries related to this topic today, please feel free to write them down in the comment section, and Dr. Sandeep would definitely address your questions. Now, moving on, Dr. Sandeep, I would like you to please help us understand why is immunization important before children start their school?
So basically, what happens is initial vaccination, which we do, most of the vaccines happen before 2 years of age. So once the child crosses 2 years of age, basically, then the children, the previous vaccines, whatever the immunity they have gained, slowly the effect of that vaccine has waned down. So we want to enhance the vaccines again effect by giving another booster to them, oftentimes, so that the child actually gets the vaccination effect better than the previous doses, and the effect is there till the child is there. In the school also, the full effect of the vaccination is there. So this is the important
So there must be some technical glitch at Dr. Sandeep's end. He would be joining us soon. And as he was discussing about, so I want all the parents who are watching our live session today to understand that today we are discussing about one of the most important topics, that the fifth year booster dose for DTP, diphtheria, tetanus, pertussis, and polio. As we have discussed that, however, it is important to understand that the child's exposure to infectious diseases increases even more during their growing phase or when they start going to the school. So, hence, this is the period which is very crucial for the parents to understand and prioritize the booster dose for their children. Now, again, we have Dr. Sandeep. Over to you, Dr. Sandeep.
Can you just repeat the question once? Hello?
Sure. So, I
Can you
asked
just
you,
repeat the question
Dr.
now?
Sandeep,
Yeah.
could you please help us understand why is immunization important before the children start going to school?
So what happens is whatever vaccination was done for kids in the early part of their life, like before 2 years, so that effect slowly goes down by the time they become 5 years or 6 years. So we need to boost the effect of the previous vaccination done by again giving the booster doses of vaccine just before they join the schools. So that is a very important part of the vaccination, which is sometimes ignored by many people, and because of that, children may have serious infections.
That was surely very much helpful, Dr. Sandeep. Now, moving on, I would want you to please help us understand what are the key vaccines that children should receive at the time of their school entry.
So at the time of school entry, the most important vaccine is the DTP vaccine, which is the booster of diphtheria, tetanus, pertussis, as well as the polio vaccine along with it. And important is to give the MMR vaccine, chickenpox vaccine, and if typhoid vaccine has not been given before, that also has to be given. Another vaccine which is very important is the flu vaccine. So these are certain vaccines which child should be given before they actually enter the school.
That was very much helpful, Dr. Sandeep. So, even if the child is fully vaccinated as a baby, so why is a booster still necessary at the school age? Could you please help us understand this?
So the thing is, because the boosters actually enhance the effect of the previous vaccination. So over a period of time, the vaccines effect actually come down. The immunity provided by the booster is come down. The immunity provided by the booster is come down. So you need to give booster to boost the effect of the vaccines. So all the previous vaccines, we need certain boosters to
I want to inform all the parents who are watching our live during this I want to inform all the parents who are watching us right now in this live session that today we are discussing about the importance of the fifth year booster vaccination for DTP and polio, that is diphtheria, tetanus, pertussis, and polio. Please feel free if you have any questions related to the topic. Dr. Sandeep will definitely address your questions and help you with the responses. Moving on, Dr. Sandeep, could you please help us understand what exactly is a school entry booster that we are talking about? And how is it different from the earlier doses? And when should it be taken ideally for the children?
So the school entry booster is basically the DTP vaccine plus the IPV vaccine, which is taken between 4 to 6 years for kids. And it is very important, like I said earlier, to enhance the effect of the previous vaccination, which has already been given. And DTP means diphtheria, tetanus, and pertussis. As we know, tetanus is a bacterial infection which can cause muscle paralysis, weakness, and diphtheria and pertussis are infections which can cause respiratory disease, matlab breathing system problems. So to prevent these infections, we need to give BTP vaccine, as well as the polio booster is given at 4 to 6 years to prevent polio in kids. These are the very important vaccines. Apart from these, you can actually give flu vaccine, chickenpox vaccine, and MMR vaccine at this age. And if the typhoid has not been given, typhoid vaccine, so that also has to be given.
Now we are understanding about these booster doses. So why is the school entry age considered a crucial window for the disease protection?
Because during the school a child will have a different kind of exposure. So when the child goes out and plays with other kids or sits in a school environment together, then there is always a chance of cross infection between the children. So that time it has become very crucial to protect them against the different diseases which I mentioned earlier. Because the incidents, whenever the child steps out of his home, sits in a school bus or in a school on a playground, the transmission from children to children is very common. So to prevent that, we need to have boosters like this.
So, doctor, what exactly is the DTAP IPV booster and what diseases does it protect the children against from?
So DTAP IPP booster is basically diphtheria, tetanus, pertussis, and AP is for acellular pertussis vaccine. So acellular pertussis vaccine is commonly known in the layman's term as a painless vaccine. So the painless vaccine causes less reaction in terms of having less pain, fever, or swelling in response to the vaccination given. And the IPV comes as a combination. So this is a very good way of vaccinating. Through a single injection, we can protect the child against 4 diseases, and these are all 4 very dangerous diseases: diphtheria, tetanus, pertussis, as well as the polio. All are life-threatening serious problems. So with the single injection, we can prevent the children from all these diseases.
Of course, now we know what is DTAP. So, doctor, why is a full dose of DTAP IPV preferred over a reduced dose, that is TDAP short, at the school entry level?
So the full dose is better in terms of immunity. So if you give full dose, the effect of the vaccination will be much better. The strength of protection or the duration of protection, the longevity of the vaccine's protection will be more. And that's why at this age, between 4 to 6 years, we give full dose instead of giving the reduced dose, which is called TDAP. So TD small T capital T small D AP is a reduced dose vaccine which is generally given to children above 7 years. But below 7 years, we give the full dose so that the protection.
So, doctor, when we talk about the polio diseases, we don't really hear about them now anymore. So, why is this still important to get the polio vaccine, that is IPVs, for our kids? Could you please explain us?
See, the thing is, polio has been eradicated in India since 2014, and that is through massive campaigns of polio vaccination from the government side, from the people of India, public, and the parents. Everyone has contributed to the massive campaign against polio, and because of that, the polio got eradicated in India 2014. But the problem is surrounding countries like Pakistan, Afghanistan, still there are small incidents of polio, and polio can again come from these countries to India. Second thing is, if the polio vaccination is reduced, the herd immunity against polio will go down, and there can be an outbreak. So always we need to maintain a certain level of herd immunity, and that's why the polio vaccination has to continue. Despite in the recent times, there is not much polio case reported. But as a community, we need to have a good herd immunity so that the disease like polio, which can make people cripple and cause paralysis, that disease doesn't come back again in India.
So, how effective is the polio vaccine in preventing the polio outbreaks?
So the thing is, there are two kind of polio vaccines. One is injectable polio vaccine, and there is a oral polio vaccine. The injectable polio vaccines are more effective in individual protection. So if you take an injectable polio vaccine, that is the injection, it protects you at a very high rate from any polio infection. Whereas the oral polio vaccine provides the gut immunity, and thereby provides community protection against the polio. So there is a herd immunity build if you take oral polio vaccine, and when you take injectable polio vaccine, it gives superior individual protection. So both are required and both are done as a part of national immunization schedule as well as the IOP vaccination schedule everywhere.
So, Dr. Sandeep, I still remember when we were kids, we used to get those oral polio drops. Do boon zindagi ki, that's how we have remembered since forever. So, how does does the child need both an injectable and oral polio vaccine as well? Why? What is the importance of IPV here? If you could please explain.
So what happens sometimes is when we take oral polio vaccine, that is a live vaccine. So that can cause a certain kind of mutation in our intestine and cause like something called vaccine-derived polio disease. So to protect against the oral polio vaccines side effects, we need injectable polio vaccine. That's why government has included very sincerely injectable polio vaccine in the primary schedule against polio at 6, 10, 14 weeks, as well as for the booster at 4 to 6 years, it is better to take injectable polio vaccines. Whereas oral polio vaccine, what it does is it when you take oral polio vaccine drops, it goes to environment and it protects the environment as a community against the polio vaccine, polio disease. So that way, both are required and both are taken at certain intervals by the community in the schedule and in the vaccination schedule.
Of course, now we understand that both the injectable and oral polio vaccine is very much important. And why is a full dose of IPV recommended, doctor, at this age, which we are talking about the school entry age, instead of a fractional or we say the reduced dose? If you could please help us understand.
Full dose is basically giving us a better protection against polio. And because we have taken the primary series some time back, like in the first year of life, so we need the booster to be given as a full dose so that the protection becomes totally effective again. So that's why full polio injectable vaccine is recommended at this stage instead of the fractional polio vaccine.
And doctor, when we are talking about the school going time, parents are completely overwhelmed and overloaded with a lot of things to look after. So during this, it is a possibility that they sometime might miss any shot or a shot is delayed. So what should parents do if their child misses the school entry booster or if the booster shot is delayed by some reason?
Yeah, it can be if it is delayed, you should always do the catch-up vaccination. Ideally, it should be taken between 4 to 6 years. The school entry booster should be taken between 4 to 6 years. So if there is any delay, you can always do a catch-up vaccination. Consult with your pediatrician; they will give the vaccine. But it is always advised to take it within time frame so that the child doesn't suffer if they get exposed to the disease.
So now we know the parents don't really have to worry if their vaccine is by any chance delayed or missed. There's still a catch up vaccination that they can get, consulting their pediatrician, of course. So if a child has a mild illness, doctor, like a mild cough, cold, can they still be given the booster shot?
Yes, they can take. See, mild cold cough doesn't interfere with the vaccine's effectivity. Only if the child has high fever or too much difficulty, then we should avoid. For minor cold cough, we don't need to avoid actually the vaccines. I always take the vaccine even with minor cold and cough.
And also, can these vaccine shots, can these boosters help protect other family members as well, like grandparents or the younger siblings, someone like this?
Definitely, see, this is what herd immunity means. Means that certain population in certain like category of people in the population are protected against a certain disease. So they then stop the chain of transmission. So like if the child is going to school and let's say he's not protected against pertussis, so he gets the pertussis infection in his body and he comes to home and he coughs. So these infections spreads by droplet infection. So what happens is an old age person whose immunity is weak, if he catches pertussis, then with the comorbidities which old age people have, there can be severe consequences and a serious disease in these people. So that's why it is very important to protect children and thereby protect the other family members also. Because if the children are protected, then the elderly family members will not get it from the child. Because like in a school, there will be hundreds of children together, and they'll be playing in the playground, they'll be commuting in the school bus together, they'll be sitting in the classroom in a very close space. So very high chance of getting infections, cross infections from each other, and they can bring the same infection to the home and can give it to the elders in the family. Aged people above 60, the grandparents may have low immunity because of their age, and they can get these serious infections. So to prevent that, it is very good option to give them the boosters and the right vaccination, so that the children doesn't get infected, doesn't suffer themselves, and also prevents the infection chances in adults as well.
Of course, now we know this would help not only the children but people around them as well. How can the parents keep track of their children's vaccination schedule, especially around their school entry age?
See, the first and most easiest way is to look at the vaccine card. Generally, what happens is both in government and private, there are vaccine cards provided to parents from the very beginning. And in those vaccine cards, whenever the doctor or the healthcare staff gives vaccine, they mention the name of the vaccine, date of the vaccination, as well as the due dates of future vaccination, as well as they sign over it. And in private, we also put stickers, labels of the vaccine, which shows the batch number as well as the date of expiry. Everything is there. So vaccine card is one method to remember about the vaccinations in future, whatever is due. Second option is definitely you can have reminders. Sometimes we doctors have some certain softwares where we can put reminders for patients, as well as the parents can follow the vaccine chart. Apart from that, prescriptions are there. So in the prescriptions also we mention the due date for next vaccination. Even in healthcare, staff also sometimes remind the parents about it. So these are the easier way to remember the vaccination. And just general one information, like we are actually creating awareness that before 2 years a child goes to school, between 4 to 6 years, we need to give the boosters for the children. So this is one method to remember it. Second option is they can themselves put in a calendar the next due date when they are actually visiting doctor and doctor has told them that this is the due date. They can actually set a calendar notification for themselves to remind themselves that okay, certain days we have to go and take the booster vaccines for the child before the child goes to school.
So now we know how can parents remember their dates and not miss or delay the booster shot for the kids. Now, moving on, we are getting a lot of questions from parents as well. Shruti is asking if the child experiences any issues after the dose. What should we do? And when should we contact the doctor?
Okay, so the common reactions which happen after vaccination is mild amount of pain at the injection site, little bit swelling can come, fever can come. For these pain, swelling, and fever, generally we can use paracetamol. And for fever, paracetamol might work. And if it is too much fever, then we can use ibuprofen. There is a ibugesic syrup and all comes. So these two medicines relieve from fever and pain swelling. And for little bit pain, we can do ice pack application. We can take a little bit ice and wrap it around wrap it inside in a cotton cloth and just put it over there. That is called ice fomentation at the injection site to relieve the pain. Apart from that, sometimes minor rashes and all can come after vaccination. In those situations, you need to visit your doctor, and the doctor may prescribe anti-allergic medicines or some medicines appropriately. Very rarely, like in 1 in million or even rarer, possibility of serious infections, serious allergic reactions is possible, but those are not seen very commonly. So, like in 15 years of my practice, I've never seen a single serious reaction happen because of vaccination. So, because of the good quality of vaccinations available these days, hardly any serious reactions happen. So, parents do not need to worry. Generally, what commonly happens is you get a mild fever for 2 to 3 days maximum, and when you give paracetamol or ibuprofen, it slowly goes away. Little bit pain swelling may appear at the injection site. Very rarely, some redness may appear. So that again, with the paracetamol, ibuprofen, and with ice fermentation, this can be managed easily.
Related to this itself, we are getting another question coming in from Manisha Chakravarti, who is asking what possible side effects can occur after the booster dose. Hi, Dr. Sandeep. Do you want me to repeat the question?
Yes, can you repeat the question?
Of course. There is another question coming in from Manisha Chakravarti, who is asking what possible side effects can occur after the booster dose. I believe there is some technical
Connection
glitch
issues
at
from
the
your
end of
side, is
this.
it?
Hi, doctor. Am I audible to you?
Very light audio is coming, but yeah, you can go ahead now. Tell me again, what is the question?
So, another question is coming in from Manisha, who is asking what possible side effects can occur after the booster dose.
Like I said, there can be pain, swelling, little bit fever might come, and we can manage easily by giving paracetamol and ibuprofen.
Of course, moving on, we are getting another question coming in from Ishita, who is asking, is this booster really needed if previous doses were given already?
Sorry, come again. Your voice is coming nicely. Come again, one more time.
Is this booster really needed if the previous doses were given already to the kid?
Yes, we need the booster for future protection because what happens is whatever vaccination has been given before 2 years, the effect starts to come down after 5 to 6 years. Slowly, the effect wanes off. So, if you don't give this booster later on in the life, like 7 8 years old child may not have a good protection against the diseases, and he might get serious infection because of not giving the booster. So, booster is absolutely recommended at between 4 to 6 years to protect for future.
Another parent named Shaima is asking, is it okay if the booster dose is a bit delayed from the actual timing?
Yeah, like I said, the slight delay is okay, but you should always try to get it within time frame between 4 to 6 years. If you give it little bit delayed, also no problem. You should go and contact your pediatrician, and they will give accordingly, according to the catch-up schedule. So if it is delayed, no need to panic. You can take it at the delayed time also, but ideally we should attempt to get it within the time frame.
Hope Shaima it was helpful to you. Now moving on, Anant is asking, my son just turned 4 years old. So when should I plan this 5th year booster vaccine?
You can take it after completion of fourth year. Anytime after fourth year, we can take. The schedule says that it can be taken between 4 to 6 years. And by year, I mean the fourth birthday, means child has completed 4 years, and then he's above 4 years of age. Then that time you can take anytime between 4 to 6 years. It's okay.
Another parent named Jessie is asking, is it okay if we prepone or postpone this booster dose? Booster dose.
Come again. What is asking?
The question is, will it be okay if a parent prepone or postpone this booster dose?
Preponing is not recommended because we need to wait till 4 years for the vaccine's time. Postponing, like I said, if it is, you can actually have a window of 2 years where you can take the booster. It's a very long window, so you can take between 6 years. Between 6 to 7 years, same vaccine can be taken, and above 7 years, we sometimes give the reduced dose vaccine because after 7 years may cause serious reactions. So that's why we give reduced dose vaccine after 7 years. So yeah, it can be taken, but it is not okay to deliberately delay or prepone. Prepone is not allowed. You can take it between 4 to 6 years, and if it is delayed, you need to discuss and take. Still, you can still take the vaccine.
We have another parent Veena who wants to understand वैक्सीन लेने से क्या कोई साइड इफेक्ट भी हो सकते हैं.
ये है कि वैक्सीन लेने के बाद बुखार आ सकता है, थोड़ा बहुत वहां पर जहां पर इंजेक्शन लगता है वहां पर सूजन, दर्द, थोड़ा रेडनेस आ जाती है. तो ये सब चीजें हो सकती है. हल्का फुल्का 2 दिन के लिए बुखार आना बहुत कॉमन होता है. 10% to 20% बच्चों को ऐसा दिखता है. उस समय पे आप पैरासीटामोल, कैलपोलकोसिन जो ड्रॉप्स होती है वो ले सकते हैं और सिरप ले सकते हैं. साथ में आइबीजेसिक भी कई बार देते हैं अगर ज्यादा बुखार आ गया, ज्यादा दर्द स्वेलिंग हो रही है तो. इसके अलावा ज्यादातर देखा जाता है कि अधिकतर बच्चों को और कोई सीरियस रिएक्शन नहीं होते या फिर सीरियस कोई साइड इफेक्ट नहीं होता है.
Another question is coming in from Lubna who wants to understand इसका कोई ओरल मेडिसिन नहीं है, मेरी बेटी वैक्सीन से काफी डरती है. What would you suggest?
देखिए, ज्यादातर वैक्सीन जो है वो इंजेक्शन फॉर्म में आते हैं. एक दो वैक्सीन ही ओरल फॉर्म में आते हैं, बट 4 to 6 years वैक्सीन में अधिकतर इंजेक्टेबल फॉर्म है और ओरल फॉर्म में वो सही तरीके से काम नहीं करता. तो पेनलेस इंजेक्शन ले सकते हैं, जैसे कि डीटीएपी है, उसमें रिएक्शन, फीवर, स्वेलिंग कम होता है. और नीडल जब बच्चे के हम डालते हैं तो बच्चे को डिस्ट्रैक्ट कर सकते हैं, उसका ध्यान किसी चीज में लगा सकते हैं, गाना सुना सकते हैं, कोई टॉय दे सकते हैं जिससे उसका ध्यान कहीं और हो. तो हम अगर जल्दी से इंजेक्शन देते हैं तो कई बार बच्चों को पता भी नहीं चलता कि इंजेक्शन दे दिया गया.
Another question is coming in from Achal who wants to understand मैंने बेटे को नहीं कराया था ये बूस्टर डोज बट वो अभी ठीक है, तो क्या अभी 6 साल की उम्र में उससे ये बूस्टर डोज दिलवाया जा सकता है? What would you suggest?
हाँ, दे सकते हैं. We can give this booster dose, no problem. We can give, even if you are missed, we can always take the booster later also, no problem. We can just see what is the age of the child. If it is 6 years, we can give the same vaccine, no problem.
Another question is from Amisha who wants to understand my daughter is prone to allergies. Would the vaccine still be safe for her?
Sorry?
If a child is prone to allergies, will the vaccine still be suitable for her?
The thing is, allergy to, let's say, dust, cold, or anything else is there. That doesn't prevent the child from taking vaccine. But if a child has had vaccine and he has shown a reaction previously to the vaccine, same vaccine cannot be given. We need to avoid that vaccine in that case because allergy is a very generic term. You can have allergy to many things. But if you don't have allergy against any component of the vaccine, then you can definitely take the vaccine. It is okay. But if you had a vaccine reaction to allergy reaction to the vaccine in past, and then you need to discuss with your pediatrician whether to give or not. But if the allergy is to something else, let's say for dust allergy or any other allergy, food allergy and all, you don't need to avoid vaccines.
Another question is coming in from Shraddha who wants to understand क्या ये वैक्सीन कभी भी लगवाया जा सकता है?
No, the vaccine booster is between 4 to 6 years. It can be taken any day, no problem, and any time of the day also is fine.
Supriya wants to understand is there any painless way or is it very painful? Can we expect some side effects as well?
Hello? Pardon, come again?
Hi. So, another parent, Supriya, wants to understand is this vaccine painless? And is there any other side effects that we can expect from this dose?
So DTP vaccines are painless vaccine. Painless means that the reaction because of vaccine which happens in the forms of fever, cough, fever, pain, swelling, all those things will be very less, very minimal, and sometimes may not happen also. So that is the painless vaccine. Yeah, it is painless, is available. DTP plus IPV combination is available, and that is considered painless because the reaction is very minimal. Sometimes children do not experience any fever, anything, or even the reaction pain swelling does not happen, and it is totally safe to give. Like I said, minor reactions, fever, pain, swelling can happen, little bit redness can appear, but these are not very common and it is not very troublesome. Also, within 1 or 2 days, these things get cured and by itself only. These are all vaccine related immune changes which happen. That's why these things come.
Another parent named आशीष सिंह wants to understand, बच्चे को प्राइमरी वैक्सीन दिया है तो फिर इसकी क्या जरूरत है? तो क्या ऐसा कह सकते हैं कि पहले वाला वैक्सीन काम नहीं करता? What would you suggest?
नहीं, काम तो करता है, बट पहले वाले वैक्सीन की इफेक्ट धीरे धीरे टाइम के साथ उतना इफेक्टिव नहीं रहता है। तो धीरे धीरे उसका इफेक्ट थोड़ा इफिशियंसी में कम होता है। इसीलिए उसकी इफिशियंसी को फिर से बूस्ट करने के लिए, बढ़ाने के लिए हमें बूस्टर डोज 4 to 6 में देना होता है।
Another parent named Aliza wants to understand that my daughter got her booster last year itself. So, will she need another in the future as well?
So one booster is given at 4 to 6 years, and depending again when you take between 4 to 6 years, then next dose will be at 10 years. One Tdap booster is given at 10 years.
Another question is very much common amongst a lot of parents, which is coming in from Tanu, who wants to understand vaccine के बाद fever क्यों आता है बच्चे को? ऐसा तो नहीं होना चाहिए. What would you suggest?
The thing is, when vaccine is given, the vaccine is the killed form of bacteria or virus, but it has the antigen. Antigen are the part of the vaccine which is very important for our immunity cells to get trained to fight the infection. Okay, so like you do exercise. So when you do exercise, your body parts sometimes do have little bit pain, but that makes your body strong. So similarly, when the vaccine is given to child, the antigen in the vaccine triggers our immune cells to become strong. So that time the mild reaction causes the fever, but it is never an infection because the vaccine components are killed bacteria or viruses or inactivated form. So they cannot multiply in our body. They can only train our immune system against the infection. It's like a mock drill.
Another parent named Bhumi wants to understand, my son got all of his early vaccines already. Booster लेना important है क्या school admission के लिए?
Yes, I think most of the schools do check whether your vaccines are taken properly as per the age. And like I said again and again, that boosters are important to boost the immunity, whatever has come down because of the time passed between the primary dose and the booster dose.
Another parent, Tanya, wants to understand that can I give any medication to my child just to ensure that there are no side effects after the booster dose?
We can generally give paracetamol. Some paracetamol can be given so that the fever pain which comes because of the vaccination that can be reduced. The child will not experience so much. That's the only thing. And that also we don't suggest as the preventive measure. Only if the fever and pain happens, you can take paracetamol.
Another parent named Falak wants to understand, is it safe to delay the booster vaccination?
You should not delay by deliberate efforts, but by any chance if it is delayed, you can give it after once you are able to give. Consult your doctor; they will give it as a catch-up schedule.
As we have discussed earlier as well, not to deliberately avoid or delay the vaccination process, but surely for those parents who have by any chance mistakenly missed their vaccine doses can definitely go and try the catch up vaccination of dose, of course. Moving on, we have Payal Chauhan who wants to understand, हमारा travel का plan है next week, तो अभी booster कराना सही रहेगा?
You can take the vaccine, no problem, because there is the reaction only happens for 2 to 3 days maximum. Actually, most of the fever or the pain comes on the first day itself. After that, it doesn't happen. So it's fine. Within 2 to 3 days, the vaccine reaction or whatever side effects will settle down. You don't have to bother if you have 1 week time between the vaccination and the travel.
Though we are getting a lot of questions, but since we have time constraint, Dr. Sandeep, I would request you to please tell us about this important topic that we are discussing today. Any three suggestions that you would want parents to keep in their mind regarding the importance of this fifth year booster vaccination that we are talking about, DTP, that is diphtheria, tetanus, pertussis, and polio? What would you suggest?
So these are all four very DTP and DTP plus IP, diphtheria, tetanus, pertussis, and polio. These are all four very serious diseases and can cause serious problems in children. So as a parent, whenever you are likely about to send the child to the school, please take these boosters and protect the child against this infection. That is number one. Second thing is, by chance, if you have missed or you don't remember, then please go to your pediatrician. Don't hesitate and ask for help. They will do the catch up schedule. They will give the vaccine so that the child is protected for future. Third thing is, whenever you do the vaccination, what I suggest to my patient is always make a digital copy of it, because the physical copy of the prescription or the vaccine card where the doctor signs and puts sticker sometimes may be misplaced, sometimes may be lost. But if you make a digital copy, means you take a photograph by scanning the vaccine card and save it in your Google Drive or in the Gmail, mail it to your spouse, so that that becomes a permanent record. So after 3 4 years, when you are actually looking for the vaccine card, you may not find, but if you have kept it on the child's name, let's say the child name is Arav, so Arav vaccination chart karke, if you have saved in Google Drive or you have saved in Gmail, you can always search and find it as a handy tool to actually show it to school later on. Or sometimes parents send their children to study abroad, that time also vaccination proof is required. So anytime in future reference, you can use that copy.
Of course. Thank you so much, Dr. Sandeep, for this amazing, informative session. And also, I would like to thank all the parents that have joined this live session. Hope this was helpful to you all. Thank you.